Hi and welcome to Tuina Chinese Medical Acupressure. This is the week 2 lecture and my name is James O'Sullivan. First of all, let's talk about definition of Tuina. Exactly what Tuina is. Tuina is the study and practice of a series of Chinese manual clinical techniques which are used to prevent and treat disease based on the principles of traditional Chinese medicine. In Tuina we use the same chi points as in acupuncture. However, we stimulate the chi points with fingers, knuckle, thumb, elbow pressure instead of the insertion of needles. The pressure of the manipulation either acts on the body directly or on the channels to regulate diseased or organs that are in disharmony or tissues. Tuina is used to prevent and treat disease by using a variety of different kinds of manipulation to activate the channels. It also balances yin and yang and regulates the circulation of qi and blood, and it normalizes the function of the zangfu. Tui literally means to push or move along, whereas na means to hold or grasp. Tuina is a comprehensive therapy. It treats both internal and external conditions, also treats traumatic injury and musculoskeletal problems, obstetrics and gynecological issues and problems, pediatrics, ear, nose and throat problems, and it strengthens the body's resistance to disease and invasion of pathogens. Tuina is also noted for its simplicity. The manipulations are easy to learn. It may be performed by anyone provided they have an understanding of traditional Chinese medicine. And this is particularly true of pediatrics. Tuina can be performed not only by a physician, but also by the parents of the child. Tuina is safe and free from harmful side effects because it's an external therapy. The manipulations performed on the surface of the body, and this allows the patient to avoid medications or invasive surgical procedures which may cause other kinds of physical damage. Tuina has almost no side effects if the diagnosis and manipulation are correct. It is very effective for relief of pain. Tuina is inexpensive and convenient. It requires almost no equipment or special medical facilities, so it is an inexpensive therapy. It may be performed anywhere the patient needs medical care, even at home. So costly and difficult hospital visits and care are therefore avoided. In common with all traditional Chinese medical therapies, Tuina has its own specific benefits and advantages in practice and treatment. It is becoming more and more popular worldwide as a result. There are 4 aspects that constitute an effective and beneficial Tuina treatment. First would be appropriate duration, where the manipulation techniques are required to last for a reasonable period of time. This will be discussed more in class. Appropriate force is where the practitioner should apply certain amount of force when employing manipulation. The degree of force mainly depends on the constitution of the patient, the nature of the disease and the location of the disease. Appropriate rhythm is where the practitioner employs good rhythm, tries to avoid using sudden fast or suddenly slow rhythm, and sudden strong, sudden light technique. The 4th aspect of an optimum Tuina treatment is gentleness. Good Tuina techniques are light but not shallow, strong but not clumsy. They try to avoid rudeness in using the techniques, and certainly violent force should be avoided. In addition, the practitioner tries to be natural while changing or when changing between different techniques. A good practitioner should always bear these aspects in mind in practice. Practice and more practice is the key to the competence in achieving these requirements. As far as contraindications are concerned with Tuina, first of all we need to protect our patient and our professional reputation. Severe cardiac, pulmonary and encephalopathic disease or extreme constitutional weakness are contraindicated to Tuina treatment. Recent history of bleeding or disease of the blood. Local skin lesions or skin diseases. When we talk about those, we're talking about tinea, scalds, burns, where the skin may be damaged or the condition aggravated by manipulation. Acute communicable diseases, bone tuberculosis would be a case in point. Acute spinal injuries or injuries without a clear-cut diagnosis are contraindicated. Pregnancy beyond 3 months, menstruation and postpartum lochia would be contraindicated. Psychosis or intoxicated patients will not be worked on by competent practitioners of Tuina, or even after overeating. Benign or malignant tumors, severe degenerative diseases such as osteoporosis. Those are the contraindications. So what can Tuina do for our patient? We can work on musculoskeletal disease and trauma, sprains, contusions in soft tissues, dislocation and subluxation of joints, non-infectious inflammation of joints, stiff necks, cervical spondylosis, lumbar sprain, prolapse of lumbar intervertebral discs. We can also work on internal diseases, epigastric pain, headache, insomnia, bronchitis, cholecystitis, hypertension, diarrhea and constipation. We also work on external diseases. Pediatric diseases would be, we work on children, cough, fever, diarrhea, dysentery, vomiting, malnutrition, constipation, retention of urine, bedwetting and the likes. We work on ear, nose and throat conditions, numbness of the tongue, difficulty swallowing, sore throat, myopias, and rhinitis. That concludes the lesson for today. I hope you found it useful and see you in class. Sláinte.